Welcome back to Twin Cities Live. Ben Lieber is co-hosting with me today. And you know, you always hear people say stuff like, I'm OCD, or my OCD is kicking in. Sometimes you think that when you like obsess over, did I forget to turn the stove off or something like that? But it is a real disorder, and it's one that Carrie Underwood has been pretty open about. She says certain things have to be in their place. She's never late for anything, and those are some of the characteristics. But what is OCD really? I sit down with Dr. Puneet Narang. He's a psychiatrist at Regents Hospital to find out more and to learn more about mental illness and its stigma. Hey everybody, I'm here with Dr. Puneet Narang, and he is a psychiatrist at Regents Hospital. Nice to see you, Dr. Narang.
Likewise.
Mad Men fans are pretty excited because the show's returning this weekend, and of course, Jon Hamm plays Don Draper in Mad Men, and he's talked about the depression that he's battled, and he's gotten therapy and used antidepressants to help him handle it, and he also talks about it being an inspiration for his character. But depression has got to be one of the most common issues that people deal with.
Yeah, depression is actually one of the most common psychiatric conditions. Most of the recent studies have shown that 1 out of 8 or 9 Americans suffer from depression every year, so it is quite prevalent. One of the main treatment options is medication, the second is the talk therapy, and less commonly used but very effective treatment is ECTs, also called shock therapy.
That one you kind of hear about and think about as being in old movies and things like that. What does it actually mean?
It sounds very scary when you think about ECTs because the general perception is very negative about this treatment. Over the period of time, it has developed to be a very safe and effective treatment. It's done under general anesthesia and it's painless procedure.
So have patients seen some pretty big improvements?
I have seen dramatic and remarkable improvement with patients who get ECTs.
And depression has to be more than just feeling kind of sad. It's a bigger issue than that.
Well, we throw this word around quite a lot, that I'm feeling depressed or down. That does not mean that person is clinically depressed. In order to have a clinical depression, you have to have consistent and pervasive symptoms for more than 2 weeks, in which person would feel down, depressed, hopeless, they become suicidal, they lose interest in activities, and they lose enjoyment.
And then there's Carrie Underwood, and she recently opened up about dealing with obsessive compulsive disorder. She says she deals with this all the time. People talk about OCD, another term that people throw around a lot. What exactly does it mean if you have the disorder?
Obsessive compulsive disorder is one of the common anxiety disorder. It comprises of both obsessions and compulsions. So what obsession means is you have this recurrent repetitive thought which gets stuck in your brain and you're not able to get rid of that thought. And in order to alleviate that anxiety, you are compelled to do certain behaviors or rituals. We call it disorder when you spend a lot of time doing the same behavior and it starts affecting your relationship, it starts affecting your personal life. If it is up to that extent, then you have to seek help.
The stigma has to be a big issue for people, particularly you're a psychiatrist, and the understanding that some people don't want to come in and get help or even talk about their problems because they're worried that other people are going to look down on them because of their mental illness.
I always tell my patients that you should not isolate yourself, you should seek help, and you should speak out about your mental illness so that other people realize that these conditions are treatable and there is a help available.
Thank you so much, Dr. Narang. We really appreciate it.
Thank you.
And you can vote for next week's Doc Hollywood topic. You could win a subscription to People magazine to keep you up to date with all the celebrity gossip. So to enter, text Doc1, Doc2, or Doc3 to 42379 for the topic you want to hear about next week. You can choose from Michael Bublé, Lil Wayne, or Dorothy Hamill. And we want to thank Health Partners Clinics and Regents Hospital for sponsoring the show. You always want to check with your physician if you have any kind of health concern. And if you have any sort of mental illness, just go and get it checked out.
Yeah, please do.
Ditch the stigma.
Yeah, please do. It's good to, you know, it's for your health, it's for your family. Yeah, go get checked out.
And you can feel good.
Yeah.